Hello, you're welcome to the Circle Direct podcast, the podcast that keeps you informed of the daily health issues affecting Nigerians. I am Brian Amadia, and today we will continue with the top 10 diseases affecting young adults in Nigeria. So, last week we talked about five of the top 10 diseases affecting young adults, and they are namely malaria, hypertension, gastroenteritis, HIV, and tuberculosis. We touched on their impact and what we can do about them in terms of prevention. Now, another thing we talked about is that largely young people see themselves as still because they have a lot of energy and they are vibrant. And truly, they are the backbone of society, but they can still develop health issues. Some of those health issues are preventable, while others you got to take proactive measures to prevent them. So today we are going into the other five diseases affecting young adults in Nigeria. The first we'll be taking today, which will be sixth on the top 10 diseases, is upper respiratory tract infections. These are conditions like the common cold, sinusitis, tonsillitis, and they are pretty common. They're caused by viruses and bacteria, and they can range from mild to severe when they occur. Now, while there's no specific data in Nigeria as to their prevalence, but I can tell you that it is one condition where antibiotics is mostly frequently prescribed and misused. Now, in Nigeria, the prevalence of this condition is influenced by various factors. One of such will be overcrowding, inadequate ventilation, and substandard healthcare facilities. Most times, upper respiratory tract infections may just run their course and the person gets better. Other times, it may require the intervention of treatment with antibiotics. The second disease we'll be talking about, will be seventh in the list, will be diabetes mellitus. Diabetes is escalating among younger adults in Nigeria, specifically the type 2 diabetes. Now, currently, there's a lack of research data in Nigeria regarding the prevalence of diabetes among young adults. And that's a problem in Nigeria. We hardly keep data. Now, but there's a comprehensive systemic review based on meta-analysis that did an age-adjusted prevalence rate of type 2 diabetes in Nigeria among individuals between the age of 20 and 79. And it showed a surge from 2% in 1990 to 5.7% in 2015. Now, this signifies substantial increase from say 874,000 cases in 1990 to over 4.7 million cases in 2015. Additionally, the study revealed that the prevalence rate of impaired glucose tolerance was 10%, while impaired fasting blood glucose was 5.8%. Diabetes is associated with unhealthy dietary habits, obesity, and sedentary lifestyle. Some of the symptoms include frequent urination, excessive thirst, and fatigue. And when this occurs, you shouldn't be disregarded because timely identification through glucose testing can aid in averting significant complications that can occur as a result of diabetes. The third we'll be doing today is UTIs, urinary tract infections. They are very common and more with women. Now, the prevalence of UTI infections among young adults in Nigeria is significant. It's a significant concern. A study conducted in Rivers State, Nigeria, found that 48% of the total urinary specimens collected from patients tested positive to UTI. Now, breaking it down further, the study also revealed that the highest rate of infections was recorded in patients between the age of 30 and 45 years. However, there was another study that found out that females between the age of 18 and 29 years had the highest prevalence of UTIs. Now, which was at 46%. Now, in terms of pathogens responsible for UTIs, the most common ones include Klebsiella species, Escherichia coli, or what is popularly called E. coli, and Staph aureus. Now, these findings suggest that young adults in Nigeria, particularly female, they are at risk of developing UTIs. So it is essential for us to take note of the prevalence of UTIs in our society. Another thing that we must take note of is that the prevalence vary from according to various factors, and it ranges from geographical location, healthcare access, and individual behaviors like poor hygiene, dehydration. Now, untreated infections from UTIs can lead to serious symptoms like painful urination and lower abdominal pain. So it's important where these symptoms are observed that interventions from medical practitioner should be introduced quickly. The fourth condition we'll talk about today is hepatitis B. Hepatitis B is a viral infection that affects the liver and can lead to chronic complications like liver cancer if left untreated. Now, the prevalence of hepatitis B among young adults in Nigeria is quite significant and is a growing health concern. As per any published study, there was a study published in the Nigerian Journal of Clinical Practice that the aggregated prevalence of hepatitis B virus in Nigeria was recorded to be around 13 plus 0.6%. Another study carried out among young adults seeking medical care at a tertiary facility at Olabisi Onabanjo University, Ogun State, Nigeria, revealed that the prevalence rate of about 4.5% of the hepatitis B vaccine antigen. Now, this research underscored the substantial health implication of hepatitis B among young adults in Nigeria. It also underscores the imperative for a heightened awareness, vaccination, and screening initiatives. Hepatitis B is transmitted through exposure to contaminated blood, sexual contact, and also from mother to child. Immunization is a key intervention for preventing the disease. So with prompt treatment serving to avert enduring liver impairments. The fifth condition we'll talk about is sickle cell anemia. It's old, but it's been there. It's old, it's been there, and it's still here. Nigeria is one of the countries with the highest burden of sickle cell anemia in the world, with a prevalence of between 2 to 3%, according to various studies. Now, it's a hereditary condition that affects the red blood cell, and it causes episodes of severe pain, anemia, and it can even lead to organ damage. So what can we do about these conditions? First, like I said last week, is awareness. You all need to know about these diseases. You need to know about the symptom. You need to have a health seeking behavior. Second, you got to take preventive measures like the vaccinations, routine checkups. It can never be overemphasized. And lifestyle changes. All of these, they play a huge role. Lastly, we cannot stop but continue to advocate for better access to healthcare. Everybody needs to have access to healthcare in Nigeria. Remember, your health is your wealth. And if you have questions or would like to share your story, put your comments below and we'll respond. Thank you for tuning in to the Sickle Direct podcast. Stay informed, stay healthy, take charge of your well-being. On the next time, I am Brian Imadia, signing off.